You want me to move closer? Thank you very much. All protocols observed. I want to say that we've just seen what is bedeviling the current situation. In agriculture, there are Kenyans who are ready to rediscover production. They are doing it on their own. But we have failed as a country. From a country that had surplus food to a country of deficits. Even as we talk now, we have no ugali on the table. And that is for sure. Our priority is to rediscover productivity. We must go back to the farmer, the one we just saw in Kisii. We can produce food in our farms. And we can only do that if we eliminate the myriads of middlemen in between marketing and production. And even in the delivery of services that support productivity at the farm level. We need to support the farmer through provision of irrigation, financing, marketing, storage of our food. At the world level, where Kenyans live, we need to have food stores, we need to have silos, we need to keep our food, and we've got to support marketing for the same. We cannot continue to ignore value addition. You just seen that farmer, and it is quite great that that farmer comes from a county that really struggles to produce food irrespective of what we do as a government. We must say echo to the Gusii producers. They kept feeding Nairobi, even when we have nothing from Rift Valley that used to have plenty of food. Agriculture must be allowed to feed the country. And we can only do that if we move forward with a clearly focused policy and working together with the counties. I want to say that we will ensure that healthcare is also addressed. As we talk now, there is serious disharmony in the health sector because the center has refused to empower the counties to move forward on the provision of healthcare. We would like free healthcare for all Kenyans. Within reach, you've just seen the madam there saying she's wondering how to take her loved ones to hospital. They die because there are no ambulances. We must provide ambulances at the closest possible range for people to be taken to for quality attention in our hospitals. We also need to look at and redeem the confidence that the health workers had in their profession. We cannot continue to be at war with our own doctors. We cannot afford to be at war with the nurses who must be with us 24 hours. There must be a solution to that problem. We must focus on training them, giving them opportunities to further their training. We are all aware that doctors don't engage in matatu business like some of us do. They are just in hospitals 24/7 to save our lives. You won't see another mama crying if we could pay attention to the issues we are raising. We would like to proceed and support proper devolution. We've committed ourselves to devolve 45% of the revenues of the previous year. This is meant to assure that services can actually be provided as proximate to Kenyans as is practical. Because you cannot continue to have monies in Nairobi so that the demand-driven, not the supply-driven system only looks at the vote head and decide what to buy. The end result is that you have got medicines for the wrong things in the wrong places. They'll bring you obesity medicines in rural areas where we can't even have food. We are saying that we would also like to cover the full population with the proper insurance cover, not a situation where our competitors find NHIF at 160 and raise it to 500. End result, it's of no use. It cannot be afforded by the general public. We have got to look at proper insurance that will cover the whole population, and that will have to be subsidized by the state. Because we all need to live, and we must live now. I want to say that that is going to be mandatory, and we are going to pay attention, serious attention to those issues. We would also like to work with the county government to design a national primary health care policy that will ensure that all households are then covered with primary health care. We understand the diseases that are now emerging, the lifestyle diseases, but we first eliminate as well the primary health care. So once we've devolved the resources that we need to devolve, county governments will focus on what Kenyans expected them to do. We said when we were promulgating the constitution that we, the people of Kenya, give unto ourselves the constitution, which we did, understanding it full well and understanding that we come from different cultures. And we want to use that as a strength. We believe devolution is what we set out to embrace, and we need to strengthen it. I want to assure you that we will do that as a government. My brother Musalia forgot that even in the education sector, we intend to ensure that counties pay attention to the infrastructure in the primary schools and the secondary schools. We will also ensure that the question of teachers is addressed. We have got a serious shortage of teachers, and yet, come to think of it, they are unemployed for more than 10 years, even after graduating. Yet we have got shortage, that particular shortage. I just wanted to mention that. But I want to also continue and say that we need to provide clean drinking water to every Kenyan. It does not matter where he is. That can be sorted out. We cannot continue to provide water pans for people to fetch water to come and drink. Give them clean drinking water. We can use the water pans for our animals, and we can also use it for irrigation. Irrigation is not just for areas where there are rivers. We can have water pans and use solar power to irrigate, even for one mama. Even very simple. There is enough technology around. The only challenge is that we've not been able to focus on what must be done to move our country forward. Unless we rediscover production, we cannot say there is economic growth simply because you are just building mega projects. Development must be broad-based and must start from below. Places like Turkana that have huge water aquifers, and yet you find the Turkanas having no water. This is unacceptable. We must continue to protect our water resources as we move forward, at the same time ensure there is harmony between the people and the environment. We cannot create one to wage war on the next. I think, basically, that is all I wanted to indicate. We must ensure that pesa iende. Asante sana.